Hi everyone, my name is Raymond, and in our group we have Nathan, Tayeb, and Pavan. And our project is called Diabetes Risk and Health Behavioral Database. For this project, we worked with a public CDC dataset and turned it into a structured relational database. The main goal was to organize diabetes-related data in a way that makes it easier to analyze health behaviors, risk factors, and trends across different groups. Our database is built from the CDC's Diabetes Health Indicators dataset, and we sampled 1,000 patients from it. We organized the data into tables like demographics, health behaviors, clinical conditions, and healthcare access. This database could be useful for researchers, healthcare professionals, or policymakers who want to study patterns in diabetes risk or compare different populations. To narrow the scope, we started with a very large dataset of over 250,000 plus rows, which was way too big for this project, so we randomly sampled 1,000 patients while still making sure the data stayed representative. We also removed unnecessary attributes and focused only on factors that are directly related to diabetes, which helped keep the database clean and manageable.
The database follows a 3NF design centered around the patient table. The references to the other tables are all centered around the patient table. The patient table is the core table and holds the diabetic status data. The demographics table holds the sex, education, age, and income data. The clinical conditions include if they have high blood pressure, if they have high cholesterol, if they've had a history of a heart disease or an attack, and if they have a stroke history. There's also the self-reported health, which is how healthy does the patient think they are, how healthy they are mentally and physically, and if they have difficulty walking. There's also a healthcare axis. Do they have healthcare access or not? And if they don't have healthcare, is it because of costs? There's also health behaviors, such as if they're a smoker, are they physically active every day? Do they eat fruits and veggies? And are they a heavy alcohol user? There's also screening, which checks if they have had their cholesterol checked in the last 5 years. And there's also the vitals, which shows what is their BMI. Our stored programs were inspired by what we believe could be meaningful correlations to what contributes to diabetes. Our first question was what percentage of people from this dataset have diabetes and the total count. We found 22.16% of the random sample of 1,000 had diabetes, which means that the total count was 221. Our second question was, what is the average BMI of people within this dataset and those who have diabetes? We found that the BMI of those who had diabetes was higher than those without diabetes. The distribution of diabetes across income levels was actually higher in proportions level 1 to 3, which means that lower income levels may be more subject to positive diabetic status. How many people were smokers, pre-diabetic smokers, and diabetic smokers? 445 of the random sample were smokers, and of those smokers, 10 were pre-diabetic and 103 were diabetic. What was the distribution of diabetes across age counts, and was there a trend? We did observe a trend that people with diabetes tended to be older rather than younger, with the age categories 10 to 13, which is between 60 and 80 years old, tended to have more diabetic proportions. How many people from this dataset lacked healthcare and what percentage of these were diabetic? We found that 41 people from the sample lacked healthcare, and of that sample, 21% were diabetic, which means that there may not be a correlation between healthcare and diabetes. What is the percentage of people who eat both fruits and vegetables daily who have diabetes? We found 21% of those who eat both fruits and vegetables have diabetes, which could be interpreted that eating your fruits and vegetables may lower the chance of having diabetes. And our last question was, what is the average number of physically unhealthy days reported by diabetic individuals? We found that the average days was 7 for being physically unhealthy.
So in this slide, it kind of shows our project evolution from the start to the finish. And early on, we first had to choose a data set from Kaggle, and we landed on the diabetes data set because we realized it has enough columns that fit the project description, but it was also something that we were all interested in. After we chose the data set, we wrote a project proposal, and that was quickly turning into a project draft where we had to create our initial ERD, our schema, things like the Excel sheet, and also just write a quick summary of what we were trying to do and what we were trying to get done with all this stuff. After we submitted the project draft, we got a lot of instructor feedback, and it mostly said that our ERD and summary was really strong and almost perfect. But things we had to work on included the Excel sheet and just the overall database because a lot of the tables were empty. So with this feedback in the Excel sheet, we had to redesign our foreign key structures to match the ERD because a lot of it that was in the ERD didn't match what was in the Excel sheet. So a lot of tables and just a lot of the columns weren't in the correct places. After we fixed this, we had to correct some of the table names in the Excel sheet because some of it was misspelled and didn't match that of the ERD that was provided. After we corrected the table names, we had to assign some of the primary keys values because some of the primary keys in the Excel sheet, especially in the columns, didn't have assigned values. After that, we also had to assign foreign keys values and connect some of the foreign keys to the main Excel sheet. We used XLOOKUP to do that after looking at some videos from the previous classes. For the database, since a lot of the tables were empty, after the Excel sheet was fully updated and perfect, we imported the Excel sheet, every single sheet into each table and each column assigned to it for the database. So after that, we had to just adjust and normalize the entire database and make sure it was working, make sure it was exported well, and that it met all the project descriptions. Now that was our entire deliverable 5 completed, and after we created the database, we had to use code and kind of create our deliverable 4. That's what you'll see after.
For our project, there were a few ethical considerations we kept in mind while working on this project. The dataset is anonymous and publicly available, so privacy is protected and the data follows fair use guidelines. We also focus on analyzing trends rather than individual diagnosis, which helps keep the project responsible and avoids misinterpretation.
Hi, so if we were to have infinite time and resources for this project, these are some things that we would do. We would add more detailed medical information because it would allow us to dive deeper into health risks and also improve the accuracy of diabetes related insights. We would also include time-tracked patient data because it would observe the health trends over time rather than just single snapshots within their life to give us more accurate data and also other factors that can contribute to why they got diabetes or why they didn't. Third, we would also improve the data quality and standardization. So from the data set that we got, we realized there were some duplicates as well as just some empty rows, and just kind of deleting that and replacing those with actual data from the actual surveys, it would make the overall result a lot better and more trustworthy. Lastly, we would want to incorporate social as well as environmental factors to better understand external influences that contribute to diabetes risks. This Excel sheet focuses a lot on people's health data as well as some of their healthy habits, but it doesn't include a lot of other factors, including social and environmental factors that could definitely play a key role in people getting diabetes or people not getting diabetes.